Welcome to Exploring the Brain. I'm Dr. Brad Schlaggar, pediatric neurologist and president and CEO of Kennedy Krieger Institute. Thank you so much for joining us for this evening's Exploring the Brain webinar. Tonight's discussion is devoted to how to make sure that a child, perhaps it's your child, with one or more disabilities, receives the accommodations and supports in school and community services to which they're entitled. Our discussion will provide insight into how to be an advocate on that student's behalf and provide increased awareness of the mechanisms and processes that may need to be navigated. Now, multiple factors can be in play here. Factors like the age a child was at time of diagnosis, or that a developmental disability became recognized, or whether the disability was acquired, perhaps in the context of a new illness or a traumatic injury. There are factors related to the anticipated impact that the disability has or will have on a student's education, as well as on their capacity to learn and participate in school and community life. Important factors also include understanding the rights a child has to appropriate accommodations and supports in school so that child can succeed fully as a student and beyond. But first, a bit about Kennedy Krieger Institute for those who may not know us. We're a fairly large nonprofit organization, nearly 90 years old now. We're based in Maryland with our primary campus in Baltimore, but with multiple sites located throughout central and now southern Maryland. We may be best known for our clinical services and research, but we also have a robust educational mission. We have 5 schools that serve publicly funded students who are referred to us by local school systems from throughout Maryland and DC. These are students whose needs are not fully met by the local school system. So as an organization, we really understand that for children and teens, especially those with disorders and disabilities that are related to the developing nervous system, clinical care and education are really inextricably connected. So this evening, our panel is made up of experts on education and disability coming from throughout the Institute to address the important topic of school success for your child with disabilities. Let's talk a bit about some housekeeping notes for this webinar. If you have a question at any time, please use the Q&A button. It's likely located at the top of your Zoom window to click and then submit a question. We'll try to get to all the questions during the Q&A period at the end after the panel discussion. This webinar is being recorded, but your identity won't be shown on the screen. And the planned panel discussion will be about 60 minutes with roughly 15-minute question and discussion at the end. So let's get started. I'm pleased to be joined by a panel of experts in disability, disability rights, autism, special education, and lived experience. So Lisa, Dr. Lisa Carey, would you like to start off with the introductions?
Yes, hi, I am Lisa Carey. I'm the Assistant Director of the Center for Innovation and Leadership in Special Education. And I also run our Hospital Education Liaison Program, otherwise known as HELP, for patients with chronic and complex health conditions.
And Ebony?
Good evening. My name is Ebony Holliday. I'm the Assistant Director of Community Programs at the Center for Autism Services, Science, and Innovation. I am also a nationally certified school psychologist and Maryland certified educator.
Aaron?
Hello, I'm Aaron Parsons. I'm one of 2 vice presidents who oversee Kennedy Krieger's school programs that Brad mentioned before. One of the areas that I oversee in all of our schools are admissions, regulatory compliance, and transition services. I also work on Kennedy Krieger's workforce development initiative, Neurodiversity at Work, trying to help young people with disabilities gain meaningful employment.
And Mallory.
Hi, I'm Mallory Legg. I'm an attorney and the director of Project HEAL, which stands for Health, Education, Advocacy, and Law, which is a community-based program of the Maryland Center for Developmental Disabilities here at Kennedy Krieger. Project HEAL is Maryland's only comprehensive medical legal partnership, which provides advocacy and civil legal services for low and moderate income children with disabilities who receive services at Kennedy Krieger and their families. We focus on special education law, guardianship and less restrictive alternatives, and supplemental security income and Social Security disability insurance matters. And then I'm also pleased to introduce our panel guests. Helen Cotis and her son Bailey Cotis both have graciously agreed to join us this evening. Bailey is a former Project HEAL client, and Bailey, I just realized we've known each other and Helen for a decade now. which is a long time. They're going to share their experiences navigating the education system and also advocating for services and supports throughout Bailey's educational career.
Well, thank you and welcome everybody. And again, our goal for you, the audience, is to leave tonight's webinar feeling better prepared to advocate for your child's needs or the needs of a child you care about, to understand terminology, processes, critical time periods, and then have access to resources to support your efforts and to be hopeful about the future. So let's jump in. Mallory, let's start with you. We're going to talk about the types of disabilities that might lead to a child needing accommodations or supports in school, and then how is it determined that a child's disability qualifies them for school accommodations, for example?
Sure, that's a tough one to answer very briefly, but I'll do my best. So thank you, Brad. And I do want to start off by noting that any information I provide is just for informational purposes and should not be taken as legal advice. You invite a lawyer to the panel and you get a standard lawyer disclaimer at the start, so I apologize. But to answer your actual question, there are a wide variety of disabilities that might lead to a child needing accommodations or supports in school. And the legal requirements for the referral process to determine whether a child is eligible for either an individualized education program or what most people will be familiar with as an IEP or a Section 504 plan varies for each. But really, the rule of thumb is that it's best to make a referral in writing to the school's principal if you're unsure of the appropriate point of contact for the IEP or Section 504 team at the child's school. And we have sample letters on Project HEAL's website that families can actually use when making the initial referral. So if a family's not exactly sure what to write in that letter and how to make that ask, it's a really great template. And I believe it'll be linked at the end of this presentation or this webinar as a resource. Once school staff receive the referral letter for the child with suspected disability, the IEP or Section 504 team will meet. They'll have what's called typically an initial evaluation meeting, and the team will review that information to make and may or may not order school-based assessments to obtain additional information. And just to summarize, to be eligible for an IEP, a child must meet the requirements for at least one of the federal eligibility categories. There must be an adverse educational impact, and the student must require specially designed instruction. To be eligible for a Section 504 plan, a student must have a physical or mental impairment that substantially limits one or more major life activities. And that could really be a presentation in and of itself, but to answer as briefly as I can, that is it.
Well, I appreciate the brevity. I think that it's also worthwhile for us to unpack IEP and Section 504 a bit more. We hear these terms a lot. What are they at their core, and how are they similar and different?
Yeah, sure, absolutely. So IEPs and Section 504 plans are similar in that they both provide support for students with disabilities, but they're governed by different laws. So IEPs are governed by what's called the Individuals with Disabilities Education Act, or IDEA. And I apologize for all of the acronyms. Education law, special education law are infamous for their use of acronyms. So I'll try anything I am abbreviating, I will spell out, I promise. And Section 504 plans are governed by Section 504 of the Rehabilitation Act of 1973, which is a federal anti-discrimination statute. And so my general rule of thumb, again, it can be much more complicated than this, but is that IEPs really outline the special education and related services that schools must provide to meet the unique needs of an eligible student with a disability. IEPs include specially designed instruction, which to me is always what I think of as the big difference from a 504 plan. Section 504 plans outline accommodations and in some instances services to enable an eligible student with a disability to learn alongside their general education peers.
So Aaron, at what age should you start planning and exploring school options for your child with a disability?
It's all actually a fairly difficult question, and it's one that I know a lot of parents have spent a lot of time thinking about, sometimes agonizing over. It's difficult to say. A child can receive an early diagnosis, a late diagnosis, or even suffer an accident, which leads to the need for supports and accommodations that might be provided by an IEP or a 504 plan. So it's difficult for a parent to really know. Some children may be eligible for services and pardon me, I'm going to introduce another piece of jargon for an IFSP, an individual family service plan, shortly after birth, but that's not the case for most families. All I can say is that what's important is when you receive that information, it's important that the family engage and act immediately.
Ebony, if you could take on the same question.
Sure, I definitely agree with a lot of what Aaron was talking about. I feel like these conversations and the planning can really and should be ongoing throughout that educational journey. As Aaron had just mentioned, exploring these school options for some families may start as early as that IFSP, which would be in toddlerhood. So, right when that child's getting ready to turn 3, there may be some decisions that some of those parents have to make regarding, are they going to stay on an extended IFSP? Do they perhaps want to choose, if eligible, if the child is eligible, a school-based preschool program? So those are some decisions that families will have to make. Of course, there are always those traditional transition periods where they're going into elementary school or middle school and then high school and thinking about the supports of that school program. Overall, I would say with considerations, planning and exploration should really occur, and it can occur at any age, any stage. The important considerations would really be that match between what the child's and what the student's educational needs are, and perhaps what that school environment can provide, what their resources are, and what that support is.
So Mallory, what rights do parents and children have when it comes to school disability accommodation? And I think it's an interesting question whether rights vary from state to state.
Absolutely. So eligible children have the right to what is called a free appropriate public education, or another acronym, FAPE, which looks different under the IDEA in Section 504. It's important to keep in mind, though, that legally children with IEPs are entitled to a free and appropriate, so that second word truly is appropriate, not best, public education, which can be really frustrating for families that is the legal, that is the legal standard, because, most families, all families, right, want the best for their child. So they're both federal laws, but there are also some additional protections that vary state by state. So it's really important to look at your specific state's laws and regulations to see if there are additional protections for your state. For example, since we're all here in Maryland from the panel, there are numerous additional protections in our state, including transition planning starting at age 14 rather than age 16, which is the federal requirement. There are specific situations in which parental consent is required that isn't required in many other states. And then also the 5-day document rule for provision of IEP meeting documents. So for example, a draft IEP, assessment reports, progress reports, things like that, within 5 days before and after IEP meetings. And so again, for families, depending on what state you're in, it's really important to take a look to see what those differences are in your state.
Mallory, staying with you, are there different types of schools available for kids with disabilities, and how would you characterize them? What are they and what are their differences?
Yes, there are a variety of schools. And so I'll start it off here and then hand it over to Aaron for his input. But it's really important to remember that under the law, to the maximum extent appropriate, children with disabilities are required to be educated in what's called the least restrictive environment, or another acronym, LRE, and removal from the regular education environment to other classes or separate schools should really only occur if the nature and the severity of the disability is such that education in a general education class with the use of what are called supplementary aids and services cannot be achieved satisfactorily. So all that legal jargon really to say IEP teams really need to weigh heavily kind of what a student's needs are to make sure that they aren't being inappropriately removed from the general education environment.
Aaron?
Yeah, and that note, I would add that the word that's really important is continuum, and the continuum is broad. So the continuum really starts, as Mallory said, in the child's home school, and that's where the efforts to educate that child should begin. So an appropriate placement could be in a general education classroom, and that continuum is as wide as the child actually attending a school like ours, which is a private separate day program. But even an educator working in one of these programs, it's important for me to say that the vast majority of students with an IEP or a 504 plan can and should be served in their home school.
So Aaron, if a child is about to enter school for the first time, what's the first step that parents should take to engage with the school or the schools being considered?
You know, I again, sort of avoiding the jargon and some of the formal discussions as a school administrator, what I'd like to say is really be present. All the activities, back to school night, working with the teachers to positively insert yourself in the culture, get to know the leaders. Really what you're trying to do is establish a rapport. And sometimes you may feel like you need to do this really quickly, but it can take some time. So it's really important for families to both formally and informally engage in the school and develop and know their allies.
Ebony, you want to comment as well?
I definitely echo a lot of those comments. And I always like to emphasize that building and establishing relationships part of things. I think that's very important. And that can really look like basic communication. So just sharing information in the beginning. To other things, building to collaboration. So, as your child starts, their first school experience and what that looks like, really establish early on that you are actively engaged and that you are participating and really engaged in your child's success. And certainly that can look different for each family. Different families have different circumstances. And, maybe there are some situations that might, preclude kind of some in-person activities, and that's okay. And so maybe that's more communication via calls or emails or other types of strategies. But you just want to make sure that you're involved in that part of things. And solid communication, the last thing I'll mention is that solid communication is really that building block of collaboration. And so that homeschool collaboration is really important. That's really where we get into that active engagement, where we're both invested in a shared responsibility, shared information, to really optimize those student outcomes.
Aaron, what questions should parents be asking of school officials and or teachers about their accommodations and procedures?
Well, I guess it's important to say that accommodations and procedures in special education are child specific. So what I would suggest that if you're talking to the school or at the school level, that you're asking in a again, not an adversarial way necessarily, but to ask about staff credentials. Who are the people that are going to be working with your child? And that's a conversation that can sometimes feel uncomfortable to begin, but they're professionals and they should be ready to engage in this. The next thing that I would ask about is specifically what sort of interventions for behavioral, emotional, social, or academic programs are they using in their school against staff credentials to implement those particular interventions. So I think that's important to really be specific about what's available. And finally, what I would ask about is access to related service or clinical staff in the school setting, specifically if you've got a student with significant needs for accommodations and supports.
Lisa, this is a great time, I think, to pull you into the conversation. Same question to you. What do you think about what questions should be asked?
I think in addition to all the great suggestions that Aaron made, asking the school staff about the culture around accommodations and modifications in the school setting is a really good way to start a conversation about how everyone approaches providing accommodations, and helps you get a picture of how the school team is going to work together to support the student, but also how they're going to involve them in the learning community that is the classroom and then the greater school. So really having those conversations about what does this look like and feel like in a day-to-day setting, because we're trying to build really positive school experiences for kids, not just check off that we provided accommodations.
Mallory, earlier on, I talked about the important recognition of the relationship between healthcare and education for children. So what role does the child's pediatrician or other medical providers play in school recommendations and decisions and paperwork and other aspects of this process?
Yeah, So I think it's important to note that IEP teams are required to consider outside recommendations, but are not actually required to accept or implement them when they're made by outside medical providers. So that being said, I think outside medical providers can provide a humongous benefit to being part of the team. And so communication between outside providers and school staff can really help explain recommendations from medical providers. And so, sometimes what I actually see is that there's a disconnect. So medical providers, right, maybe using medical language, school staff use school language. And so having open communication between the two groups can really help to facilitate that back and forth to figure out what the provider's recommending. And so if parents and guardians do want school staff to be able to communicate with outside providers, typically they'll need to sign releases of information on both the medical and the school end for the two parties to be able to communicate with one another.
Yeah, Aaron, what's your take?
Yeah, definitely agreeing with what Mallory's saying, and also add that this can be a difficult intersection between the worlds, and that physicians may not understand how services are determined or provided in a school setting, including believing that, for instance, that you could write a prescription for a certain service to be delivered in the school. That's something that I've seen on multiple occasions. And of course, that's not the way it's determined, documented, or provided. But as Mallory said, it's really crucial because they're the expert that knows the child. Sometimes this can lead to clinicians feeling, not just physicians, feeling that their clinical judgment is being questioned. But really at the IEP table, discussion and even negotiation around the delivery of related or clinical services is a normal part of the process. So talking with your physician about that's going to be important when you ask them for their help.
Yeah. Lisa, what do you think?
So as someone who fills that role of helping the school team and the medical team communicate, I'm going to echo everything that was just said. But then in addition to that, I think it's really important for everyone to step back and realize that we're asking families to do a lot in helping the school and medical team communicate. And for families just to say when they go to their medical provider, help them or prompt them to write down everything that's educationally relevant, any medical advice that's educationally relevant, and to think about not just in the classroom, not just specific to math and reading, but the whole school day. So are you taking a medication that requires you to have a lot of water or to require extra bathroom breaks? We have to write that into your plan. Are you someone who fatigues easily? And now we're going to try and accommodate your seating and change your seating and give you options to take breaks. So even just encouraging families to think beyond just that intensive learning piece, but what does the whole school day look like a little bit more holistically about what those needs might be?
Aaron, back to you. So what kinds of resources are available to families who are trying to navigate school choices and decisions?
Well, again, I'll start a little bit informally, and then I think some others can dive into more details. But one of the most important I've found are family networks, both informal and formal. They're powerful groups to find someone who's experienced or has life experience similar to yours. I really believe that those are important allies for families entering special education. And additionally, I have to say, advocates and advocacy. They're very well informed. They tend to be easily contacted, and they're really experienced in the system. So that's where I would start.
Ebony, can you comment?
Sure. And I think the point I'd like to emphasize is that all states have parent centers, so kind of parent resource centers. It may be called a parent training and information center, a PTI, or a community parent resource center. There are over 100 across the country. And so it's really about looking up and seeing what that might be for your state. Here in Maryland, we have the Parents Place of Maryland, and they provide a variety of services, birth to age 26. So they're working and they're partnering with families to really empower and engage families in their child's education. So there's a lot of online resources that are available. There's partnership, there's advocacy as well. So I think overall, it's important to kind of know what your local resources are in each county. There are state resources, as I just mentioned, these parent resource centers. And then, of course, there are online resources as well. And so it's important to have maybe a couple trusted resources that could be helpful. Of course, if we're just kind of Googling different terminology, a lot of information is going to come up and it can be very overwhelming. And, there may not be a way to vet, information or to be completely accurate on what we know of. So I think it's good to have a few trusted resources. Rights Law is one that is special education and advocacy. It has a range of resources that are available. Disability Rights Maryland, I'm sure we'll provide some additional resource links as well. But those are just a couple that are out there.
Lisa, your thoughts?
I think it's really important to know what is available in your separate school system. So whatever your local system is, knowing what kinds of choices there are. We mentioned earlier that there's a continuum of services from full inclusion to special education, private programs. But in addition to that, there are things like charter schools and magnet programs. There's different levels of school choice. So just becoming familiar in your school district with what is available, and then there are usually guiding organizations that can help you with that. So for example, Baltimore City has a tremendous amount of school choice, and there's actually an organization called Live Baltimore that has a whole liaison dedicated to helping walking families through their different school choices and across the spectrum of supports.
Mallory, you talked earlier about free, appropriate public education, but what if there is in the family school district, if there's no school there that can provide what the student needs, what happens then?
So if there's no school within the school district that can provide the students' need or meet the students' needs, then a local education agency, or again, LEA for short, must consider placing the student with a disability in a private separate day school, which is also more commonly called a non-public school. This must be the appropriate least restrictive environment for the student, meaning that there are no options available within the school system. So I just always like to really stress that point, that it's not that maybe the student's neighborhood school isn't appropriate, but there's a regional program within the school system that is. You really have to go through all of those options and deem them inappropriate to be able to get to that non-public placement level. I also like to note that the IEP team must make this determination. So the process is not nearly as simple as just applying to a non-public school or contacting the non-public school. We get a lot of calls from families where, families will say, well, I spoke to someone at a school and they said that the child could, my kid could be a good fit. And it's a lot more of a process than that. Non-public placements are the right fit for some children with disabilities, but I do want to stress also that, as Erin said before, most children with disabilities are educated alongside their non-disabled peers. And that can be really important in terms of especially some of that social programming, that emotional piece, right, is kind of learning alongside non-disabled peers. So I always stress a couple of things that I come to mind. I always really stress to families not to get stuck on a specific outcome. So for example, a non-public placement or another specific placement, and rather really be open to collaborating with the school-based team and trialing supports and strategies as a team to collect data to see what works and what does not work for your child. So, again, it all goes back to, it really is a process rather than a leap in 99% of situations.
And Erin, from your perspective?
Yeah, I have to agree with all of what Mallory said, and say that if you're a parent in this position, we know that you're likely frustrated and tired by this point, but we have to ask you again to really dig into the process. The family has to become very data and outcome oriented, very specific questions about what's happening, progress the child's making or not making, and be very specific about it. It's important that the family's firm, but if possible, avoid being adversarial. Remember that most educators do want to do the right thing, but you might have to really work at this. The other piece that I would add is, because I've known so many families in this position, that the stress and the exhaustion and the disappointment can lead to difficulty managing your own emotions. So I really suggest that there's a trusted friend, family member, advocate, or even an attorney to join you in the process that can be really helpful.
Yeah. Well, I think this is a great point to bring in Helen and her son Bailey. Again, thank you so much for being here with us tonight. And Helen, if we could start with, how old was Bailey when you first recognized or learned that he had a disability, and if you could share the nature of his disability.
So I recognized in preschool that he wasn't typically developing. And then he went on to kindergarten, and the whole kindergarten year, the team or the school gathered data. And then, so it was a whole academic year. And then the first year, first grade, he was then tested for an IEP and found eligible. His pediatrician also diagnosed him around 7 for ADHD. The school team found that he had both ADHD and specific learning disability, but within his IEP, he was given the coding of specific learning disability, SLD. And then I had always suspected he had dyslexia, and then during his senior year in high school, he was diagnosed with dyslexia.
Bailey, can you share how old are you now?
At the current stage of recording or doing this webinar, I'm 21 years old.
All right. And both of you, do you both work? And if so, what's your livelihood?
At the current hand, I am working on a farm. I do farm work, just picking plants, and cutting stuff down, all that jazz.
And I am actually a former special educator. I just transferred out of the classroom, and I'm now a private tutor.
So Helen, can you briefly describe how Bailey's diagnosis affected your approach to his education, particularly from the perspective of a special educator, how that diagnosis affected your approach?
So, I mean, he was diagnosed so early on that it was kind of, I didn't have an established approach with him. But I did want to give this school staff a chance to meet his needs. And then I realized fairly quickly that what they had to offer was not appropriate. He needed additional support. And I realized I needed to get an advocate to help me get him the support that he needed, the services that he needed.
So if you could share what challenges did you encounter, and then from what source did you get help?
So I guess basically the biggest challenge was making sure he got what he needed. And we moved 2 different states, two different states and in 2 different districts in Maryland. And in all 4 of those, or all 3 of those different areas, everything was different. The experience was very different. So early on, I started getting help from other educators that weren't involved with him. They were, friends that were educators. I would turn to them and ask them questions about, what would be appropriate in the situation. And then I also turned to like my coursework, the knowledge that I had as a special educator, or actually at that time I was studying to be a special educator. And then after several years, Bailey's pediatrician recommended behavioral therapy at Kennedy Krieger. And then because we were in the behavior therapy, we were able to get help from Project Heal, and Mallory was the advocate that we had.
So Bailey, what did you particularly enjoy about school, and what were the challenges? And were there people at school or home that you can talk about who helped you in addition to mom?
Well, when I was attending the non-public placement of school, that was for about 2 years in middle school and then 2 years in high school. I felt like, in my opinion, there were more people like me. There were more like people that I can communicate with because they were more they were more helpful, and um, the staff definitely tried to work with me to accomplish a lot of my goals that, like, in a normal setting of like the public placement, that they probably weren't helping out with, or I wasn't getting at the time. And I had a lot of challenges. It was more difficult to get through some of these challenges in my public placements. Um, uh, at the first year of school in Maryland, not a lot of people were there for me when I moved to another county in Maryland. Things got really difficult, and I was physically bullied by other students. I struggled more with my peers after we moved back to Maryland when I was high school. I started at a public high school. Everyone was a lot more mature and older, so I didn't really get the issues that I used to get, like in the middle school setting or anything like that. I felt like, though, my IEP was not being implemented, which is when my mom reached out to Mallory for the second time to ask for a little bit more help.
And part of the lack of the IEP implementation was also related to post-pandemic and teacher shortage. So that was a challenge.
Yeah. So Bailey, what advice would you give to other students facing similar challenges that you described?
If you have difficulty learning different things, like if you're not learning certain things that you want to learn in the school, and you're having a lot of issue, maybe doing your homework, your schoolwork you brought home, or whatever it is, you can go to a library, you can pick up a book, you can read through it, you can go on the web. There's resources out there that can help you, especially if you're having a lot of issue with the schoolwork you're having, I feel like. And it's important to advocate for yourself, because when you're not getting something and people forget to bring it up, you should bring it up. You should always try to bring it up so that not just you, but maybe the people around you know what you really need.
Yeah. The importance of self-advocacy. Great
Yes.
point. And Helen, same question. What advice would you give to other parents just starting this journey, or those who are encountering similar challenges that what you're describing?
I think it's important to talk with other people that either have been in the situation or are, like I did, educators, people that know the process, to push for what you feel like your child needs. And if you're really having trouble, then of course, get an advocate or an attorney to help you. But also, it's really important to keep in mind that the staff are people too, and you're a team with, the IEP team. You really are a team. You're working for what's best for your child, and the teachers are there to educate your child, and they want what's best for your child as well. And when we first started, something Mallory had told me was that you attract more flies with honey than with vinegar, and that's definitely a true statement. You really have to keep that in mind. Be kind to them.
Yeah, excellent points. So thank you very much for sharing your experience and wisdom with us and with our audience. I'm going to return to now Ebony and Aaron. Let's talk specifically about an area of expertise for you both in autism. Ebony, maybe you can describe some examples of the type of help and guidance that you provide to families. And Aaron, same kind of question, but at the high school level, in a school that's especially designed for children with autism. Ebony?
Sure. So I'll just explain a little bit briefly about CASI, so our Center for Autism, and kind of how we support the families that are with us. So we are an interdisciplinary outpatient clinic, and we really provide a range of services to patients and to our families who come to our center. We look at, of course, assessment and diagnosis and treatment. And so when we do that, the focus is really on identifying those strengths and those areas of need. And we do that to see how that can assist in making decisions and supporting intervention and treatment plans. So we really want to make sure that those things are linked together, that it's strength-based. And really that recommended treatment plan could include a variety of areas or a variety of services that might look like direct service, like individual, group, or family-based therapy. It could look like consultation, care coordination, medical management, a range of service delivery models that we have as well. We look at targeting skills and building skills. And so that might be communication and language. It could be social interactions, functional skills, life skills, advocacy. There's a whole range. The main point is that we really make sure that it is centered around the child, the adolescent, and the family. So really looking at that family-based care that we are providing in those ways. We have parent training programs, we have support programs. And then the last thing I'll mention is we also have the opportunity for our families to participate in our research program. So we have optional studies that families can engage in where they're able to share their experiences. They're able to help researchers answer questions that can advance the field. And through part of that, able to sometimes learn additional information about their child. There may be opportunities for assessment and intervention services that are no cost to the family as well. So we support families in a range of ways. You know, we target a variety of skill areas really to support and to drive that treatment and that intervention plan.
Aaron?
Yeah, I guess I first want to sort of put a frame on my response for, high school for a student with autism to say that, the student may refer to himself or herself or themselves as an autistic person in high school and have very, specific ideas about what high school is appropriate for them. So that high school could be the general high school. If we're talking about a highly specialized settings like the schools that Kennedy Krieger run for students with autism, what a parent, a family, and the student should see is a density of services, and some are very specific. The schools can look different. They might have a different flavor or different focus, but you should see occupational therapists, speech language pathologists, behavior analysts, social work, of course, special educators. But that density of services, they can help the student with their, gaining access to the curriculum, that on-ramp to the classroom experience. The other thing that you should see, obviously a focus on transition, but an appropriate balance for the student, an emphasis on academics and also on essential skills. And that can be a little bit of a sliding scale, again, based on the need of the person. But I think what's got to be present inside this density of services and the focus on the individual student is significant person-centered planning for this high school student, because really what we're talking about is, their inclusion for a lifetime of experience, workforce, community, all of that. So I would say look for the density of services, look for the focus of the school, and also, to the greatest extent possible, talk to your student about what the right high school is for them.
Sometimes providing schools and teachers with educational content modifications and recommendations can also improve outcomes. Lisa, I'm hoping you could share a bit about your work, your specialty expertise, and how you interface with educators and school districts to help them provide supports that are tailored to students with learning and other disabilities. Maybe even talk a bit about the difference between a learning disability and a developmental disability, and some more jargon for us.
So in my work, I support teachers and school leaders and school systems in Maryland and around the country to learn about the various cognitive and behavioral supports that we need to put in place to support all learners depending on what kinds of disabilities they have. So to answer your question about the different kinds of disabilities, as Mallory mentioned earlier, we're looking at educational impact when we're talking about having special education. So they're all broadly disabilities that have an educational impact, but that can look very different. So a learning disability is when you have a cognitive difficulty performing academic tasks like reading, writing. So you might have a learning disability, specific learning disability in reading, specific learning disability in math, or you could have a specific learning disability in writing, or you could have multiple. And then a developmental disability is when there's more globally an impact that might look like a developmental delay, for example, and that there's a lot more support that needs to happen that goes beyond the specific academic area. There are also very frequently health conditions that require supports in schools. So we try to in school, because we're not providing healthcare in the same way, right? We're not providing treatment the way that you might get in a medical setting. So we're focused on the needs and strengths of the individual student. And there can be overlap. So you could have a health condition that impacts your reading ability and wind up getting the same types of reading supports that someone with a specific learning disability might encounter. So we really think about what are the needs of the individual students and less so about those labels and diagnoses, although those are how you kind of get in the door in the first place. So I typically teach school districts and teachers about these different disability areas, about how brains develop both typically and atypically, and what helps us learn best as individuals. We know from decades of research that teachers teach students with disabilities best when they feel supported and when they feel knowledgeable. And so providing them with knowledge and resources and helping them feel like they can provide specialized instruction, whether it's in the general education setting or a really specific setting like the Kennedy Krieger schools, and just making sure that everyone feels prepared and knows who to ask for assistance. So a lot of what I do is also just like in-time technical supports for teachers and school districts as well.
So Aaron, you're one of the leaders of Kennedy Krieger school programs that serve children, teens, and young adults that have developmental and other disabilities. What advice would you give to parents who feel that their local school district may not be able to serve their child's needs? And how does a non-public private school differ from a typical public private school?
So I have to sort of revisit some of what folks have said, Mallory, Helen. My advice is to start the conversation early. Parents tend to know when this is happening. They're talking to their children. It's important to be persistent in the conversation. Also remembering that teachers and administrators are people too, and that they generally do want to do the right thing. So Mallory's advice is very sage. But parents should insist on plain language. This is something I feel very strongly about. And they should insist on seeing the data of where their child is functioning, and to be able to track that, to see how their academic progress is being impacted. Another piece of advice that I give is to avoid the echo chamber. You should be discussing this with others, whether it's friends, families, an advocate. But usually if the advice you're getting is that you're always right, that's not solid advice. So that's why I say avoid the echo chamber. You should be hearing different opinions. And most importantly, know your rights and know your child's rights. There's really nothing more important. And again, I've mentioned it several times. I know it can be tough because parents are usually very tired at this point, to handle it as civilly as possible, and to, approach it with assistance if needed. So if a non-public school is an option, it can be confusing because there are private and non-public schools. One of the things that's difficult for parents when they join us to understand is that non-public schools serve publicly funded students, and we are partners with the local school systems. We literally work with them every day. We're serving their students inside our school, and we are in agreement with the local school system that we are able to provide the supports and accommodation and services that are necessary to make this student successful. So we generally have good relationships with the local education agency or local school system, and work in partnership with them. Non-public schools are a little different than private schools. Private schools, I'll use one more piece of jargon. Of course, you're not eligible for FAPE. It's not free access to public education. You're going to pay for it. But there are some highly specialized private schools out there that do a very good job. And private schools in general are obligated to provide the supports required by a 504 plan or another one, the ADA, the Americans with Disabilities Act. But if you're coming from a local school system, the LSS, and you're looking for a non-public school, it's important to remember that we're their partners and we want to assist them and we want to assist you.
So really a last question before we move on to the question and answer period. Let's talk about how, to what extent you all collaborate or work together on behalf of a student or a family. So Ebony, let's start with you, and others can chime in. But Ebony?
Sure. I always come from the perspective of, the importance of connecting and really looping families into as many resources and supports as are available and that they can access. And so I think it's common, and we frequently refer families to additional programs and resources across the Institute. It's not unusual, I think, for some of our families and patients to be participating in more than one program or department. Just, as an example, we may have some patients that we see, or some children or adolescents at our center, and maybe perhaps there are also students at Kennedy Krieger schools, or we may, see some families in some of our groups that we have, and maybe they're also receiving services from our behavioral psychology department. So it's not unusual on those cases, and sometimes we, talk with families about the benefit of really collaborating among providers, just to make sure that we're aligned and we're all on the same page, and really making sure we're working on behalf of the family. There is also times that we may refer, of course, to Project HEAL and Mallory and the supports and services that program provides. There's a great resources, link that families can benefit from, just, even on their resource page, going through some of those online programs and things. So I think definitely we refer across the Institute. We collaborated and work together.
Mallory, you want to pick it up?
Yeah, absolutely. So I would definitely say Project HEAL attorneys collaborate with our Kennedy Krieger faculty and staff and trainees all the time. Actually, Lisa and I were collaborating about a patient earlier today. We were on a Zoom together. And so really on a daily basis, we're working with our medical providers, our other clinical providers, our school-based staff to kind of, try to collaborate to help patients and advocate for them.
Great. Well, thank you all. It's time to answer some questions submitted by our audience members. And if you're in the audience and you haven't submitted a question yet, please enter your questions in the Q&A section of Zoom. A lot of questions have been submitted already, so let's get started with that. I'm gonna put these on to read them. Okay. So first question, and I think I'll ask Mallory to take this one. Where can I find the requirements set out for DC law?
Sure. So if you look to the DC education statute, and I actually don't know that I have access to a chat. I was gonna say, if so, I would pop it in the chat as people were going. So if you Google Washington, DC special education statute and regulations, that should get you to where you need to go. I'm only born in Maryland, so I'm not exactly, I can't give you a specific code site or anything like that. But also each state and DC have a protection and advocacy agency. And so that also is a great place to start if you have questions and are looking for resources about your specific area's laws and states' laws and districts' laws. That's a great place to start as well.
So there are questions that are really thematically very connected. So I'll sort of merge them as they come up. But so here's a question about what is the measure for determining whether a school is not meeting the student's needs, or what if the parent feels that way, but the school does not, or there's not alignment? I imagine that's, Mallory, your first crack at that, but I think others can chime in as well.
Absolutely. So we see that all the time. And oftentimes that's why a family is reaching out to us, right? They feel that either their child is not making progress in school and that's what is not being really progress is not being documented, or they feel that their child is not making progress, but the school team is saying, absolutely, we're seeing progress. Your child is doing great. And so I think there are a couple of strategies for families in doing that, kind of looking at that is one is to really look at the paperwork over time. And again, I know we keep going back to putting a lot on families, right? And I do want to acknowledge, but what I typically do when I am screening a case, right, for a new client is I look at IEPs year to year. I look at IEP progress reports year to year. So here in Maryland, we have quarterly IEP progress reports. And I really take a look at two things. One are the kind of skills in the goals progressing. Are they getting more difficult? And then also, is there data that the student is actually achieving those goals? And sometimes I take a look and I say, actually, absolutely, we're seeing forward motion. This looks appropriate. This is great. And then other times, really, you see kind of some red flags I look for are repeated goals, and here in Maryland, objectives on the IEP year over year. Progress report statements with absolutely no numbers or data in them was always a red flag. Present level sections of the IEPs really copied and pasted year to year. So if you're looking at that beginning section of the IEP that has how a student's doing in, their areas of need. So for example, mathematics or written language, and you're seeing the same thing there year after year, that's also a huge red flag. And so, we definitely don't expect parents, right, to know all of that, but I think that's also why it's really important to kind of talk to people, look at resources, make sure you're kind of networking to really best advocate for your child.
There's a number of questions that are really framed around specific kinds of challenges that families are facing. We need to make clear that we can't be providing really individual specific legal advice or advice that we can respond to the questions, but really as exemplars, not as in real specificity. I hope that's understandable. So here's an example where the child is in home and hospital, and the clinician is no longer willing to continue to sign papers to support the home and hospital. And there's the strong sense that there's loss of IEP services because at this time there's no placement no school that will take that student. I think that's also a Mallory question.
I get lots of questions tonight. This is fun. So there is great guidance. It's a technical assistance bulletin. And again, I don't know if we're sending a follow-up email to attendees, but I'm happy to include all of this in the resources page. But if you go to the Maryland State Department of Education's website, there is a home and hospital teaching bulletin. It's a supplement for students with disabilities that explicitly says that home and hospital teaching should not be used while awaiting placement for a student with a disability. And so I know that can be a difficult process, right? Because in the process of awaiting a placement, the current school, the home school, or wherever the student was previously, right, has said, we can no longer meet the student's needs, but they really do need to provide supports and services in that interim period while searching for an appropriate placement, because I'm sure Erin can elaborate on this, right? A lot of the non-public schools are very full right now. And so it can be really difficult to find an appropriate placement for a student in a timely manner.
Here's a question about transparency. Is there a way to know how the district is spending the money that the census should be being spent on your child's IEP? What kind of transparency is there? I think that's Mallory too.
Oh boy, I'm just getting them all tonight. So in terms of transparency, I mean, I don't know that it would be very easy to go back, right, and find dollar per dollar and match that to the, for the student for that specific school district and match that to the amount that's being put into that IEP. But what parents really can do is to whatever services are in the student's IEP, right? So if the student has 1 hour a week of speech and language services, or 30 minutes a week of occupational therapy services, that there should be service logs for every provider who's providing services, and families can ask schools for that record. So that way families can see, is my student receiving all of the services that they're supposed to be receiving? And so I think, you can't really go back and say, is my student receiving $13,000 worth of specialized instruction or anything like that, right? But you can look to see, based on what's in the IEP, are they receiving the services that they're supposed to be receiving by the provider at the frequency and duration?
So I think this is a question for Ebony. You mentioned parent training. How can a parent or guardian get involved in the parent training?
So I think it would depend on what specific type of training the parent was interested in. We have general types of services related to advocacy that may be open to the community. We do, at our center, we do a lot of different types of webinars as well, and training and outreach. So some of those we would advertise, and those would just be freely available to the community. We also have some more specialized types of parent training that might be available for families who are patients at our center. So they're receiving services, they have providers, they may also be able to access different types of groups and parent training in that way. So we again have community-based types of services and trainings that are available to families, but then also specific types of therapy-based trainings that are available through our clinic and for our patients.
Ebony, I think here's another one for you. The question is, suppose there's a situation where a clinician, OT, psychologist, physician makes a recommendation, a specific recommendation, and the IEP response is yes, but we'll talk about it at the next meeting 10 months later. As a clinician, how do you take on that kind of situation on behalf of your patient?
I think I would really look at that advocacy piece and make sure that conversation isn't tabled until that next meeting. The parents, as Mallory, I think, has talked about a lot through this webinar, there are rights that are important for families to know that they have. And if they feel like there is a topic that hasn't been sufficiently covered, I think it's perfectly fine to request a meeting, request that the team continues to have that conversation, talk about why the family, feels that a certain type of service would be beneficial for that child, really have that open conversation. So I think it's okay to not be, as a parent or a caregiver, to not be satisfied with just a no from the team, but to really explore that a little bit more, to ask questions. And then again, that might be part of that advocacy piece as well. So it may be where the parent needs to gain a little bit more information on, how do I advocate for this in another way? What resources do I need to be involved with? But it isn't infrequent that, you may have a school team that says, oh, we may not be able to implement that, or we may, not choose to implement this now. But I would say continue to have those conversations. The family can request that, those conversations to be open as well, to see what really is best to meet that child's needs.
Erin, there's a question about the how a parent or guardian can monitor the actual progress and implement with an IEP and the implementation of the elements of the IEP from the school side. How do you, what do you consider to be the way to communicate that with families to keep them apprised, not just in between, not just at the meetings themselves, but along?
Right. I think regular communication with the teacher, or if they've got a case management system with specific questions about the goals and objectives on the IEP, I think it's important that parents, and again, I know this is a lot of work for the parents, I know you're busy, but that they gain an understanding of the curricula, the curriculums that are being used, grade level function for certain topics or subject areas, and so that they can really engage with the school to see how their student is progressing, especially if the goals are somehow impacting academic performance. But I think being very specific, being regular in your contact, having questions that are drawn directly from the IEP, and have questions that require data to be supplied. And then you really have to begin to map this data yourself. And again, there's other parents who've shared this journey, they can assist you with it. And it's really the only way to monitor progress.
Another legal question, do private schools, are they obligated to abide by IEP, Section 504, the Americans with Disabilities Act? What are the obligations for a private school?
Sure, yeah. So private schools are not required to implement IEPs. So for students in Maryland, there is basically a pot of funding available for private school, and this is the same for homeschool students as well. So, families can reach out to their local education agency. They can go through the IEP eligibility process, and the local educational agency can say either, here's what we would provide, but we're not going to provide any services, or here's what we would provide if your child was a public school student, but we're only going to provide X, Y, and Z services. So they might provide an hour a week of speech services, and they're generally not going to come out to the private school, right? And so the student is going to likely be going to their neighborhood school or some other site to receive those services. And I also like to note that there is no legal entitlement to those services for private school students. So if the private school, or if the LEA comes back and says, we're not going to provide anything for your private school students, there really isn't any appeal right or anything like that to that determination. And so, I always tell families, and I'll jump to 504 next, but basically for 504, schools need to provide reasonable accommodations. Different private schools handle 504 differently. So some have a document that kind of has the name or the flavor of a Section 504 plan, right? But some don't. There is no requirement under Section 504 for anything to be in writing or for there actually to be a cohesive plan. And so really it is advocating for specific accommodations that are reasonable for the student, and discussing that with the school's administration and disability support services office if they have something that's specific there. Hopefully that answered the question, but if I missed anything, please let me know.
I'd also just add for if your student is in a private school, to find out what the relationship is between that school and the local school system, because local school systems all have different setups with the private schools in their catchment areas. So for example, I taught in St. Mary's County public schools, and we provided a lot more services to students who were private school students than I feel like I saw when I was teaching in Baltimore County. And a lot of that is just about resources in the community in general. And so there was a different memorandum of understanding in that place at that time that was different based on what available resources there were.
Mallory, I think lots of questions your way. One of them, not surprised, is getting an advocate or a lawyer through Kennedy Krieger free of charge. How does your service work?
Sure. So our service, one of our requirements is that the child with a disability is a Kennedy Krieger patient. We provide legal services on a sliding scale fee basis based on household size and income. So it varies depending on the family's financial situation and household size. One thing I do like to note is we're a pretty small program, so we don't provide legal services in every situation or direct representation, right, in every situation for where a family reaches out to us. Our intake process is we have an online intake on our website, or we have an intake line phone number, which is 443-923-4414. Just throw it out there for everybody. You can complete an online intake, which is the quickest, a phone intake. And whether or not a child is a Kennedy Krieger patient, we always provide kind of some brief advice, information, document review, resources, referrals. We call that limited representation. And then for Kennedy Krieger patients where it looks like there might be legal issues that require the intervention of an attorney, we then have more of a document review process where we talk to the family about their goals. And then if the family's goals, based on our review of the documents, kind of meets what we think we're able to do, then we would look at potentially opening a case for that student, and so for that patient. And so it's a process, and we're always happy to kind of screen cases, talk to families, and in situations where we might not be able to provide representation, we also provide referrals to other resources within the community.
Bailey, I got a question for you, or actually a couple of questions. Can you describe, is there anything you wish could have been done differently for you? Anything you feel you missed out on, or something that was done particularly well?
I feel like when I was younger, especially because like you know, I wasn't. A lot of people didn't want to hang out with me, so I kind of wished like I had a bit more like friendships with people around me when I was younger. Because I was different. I acted different. So people were like, "Who is this kid?" So I kind of wish I had something like that when I was younger. But I feel like the best part about having the disability is when I did find the people that did want to hang out with me, I felt the happiest I felt like I've been in a long time, or I felt the happiest I've never felt before.
Got it. This is a question for Ebony and Aaron both. What do you recommend for advocating for a nonverbal child with autism? Ebony?
I would, my perspective is going back and really taking that individualized approach and seeing that, while the child might be nonverbal or non-speaking, what's the range of skills? What are their needs? What are their strengths? And from that, building an individualized plan for advocacy. So really seeing where they're at while they may not be speaking, how are they communicating? And what do we do from that? How do we advocate on that behalf? Really prioritizing what those goals might be that we want, what skills we want to build. So again, I would always go back to that individualized approach, making sure that we have a clear picture. If there is assessment that needs to be done, that we have that information, that we have that data that we can then use to form more specific intervention or treatment types of goals as well. So I would add that individualized part.
And I think I would agree and add to that. It's in a school, it's all about functionality. And of course, as you enter the workforce and, community, it's about communication and function. So I'm interested in communication devices for the child. We're talking about as far as acquiring communication, whether that's something verbal or sign that might be in the child's future. I think when you're talking with schools about it, it's important to have a very grounded conversation talking about evidence-based practices and to talk to multiple clinicians about what might be advised for that child. There can be a lot of information, some of it misleading, about what might be effective in a school setting or in a home setting. So I think, while getting broad opinions is important, it's important to talk to experts in the field. And again, really individualize where that child is and where they're headed as well. And again, assistive technology has been a wonderful thing. So, the idea of being nonverbal, things have changed. I think we've made great progress. So again, individualized, but evidence-based.
So we have an enormous number of excellent questions, and unfortunately, this is all the time that we have this evening. I really want to thank our experts and guests, and also the audience for so many great questions, and for participating. We hope that you found this Exploring the Brain webinar to be informative and helpful. You'll receive an email from Kennedy Krieger shortly with links to resources that were described during this webinar. And then we hope you'll participate in future Exploring the Brain webinars. Follow Kennedy Krieger on social media and listen to our monthly podcast, Your Child's Brain, which is produced with assistance with WYPR here in Baltimore. And you can find it at kennedykrieger.org/YCB or wherever you get your podcasts. And then for more information about Kennedy Krieger Institute and how you can support our work, please visit our website at kennedykrieger.org. And thank you all. Have a wonderful evening.